I'm Dr. Brandon Lancaster. I'm a family physician here at East Tennessee Medical Group. What I like about family medicine is you can just kind of create like a relationship with the patient, and not every single patient, is equal. You can get to know the patient and decide kind of what their healthcare goals are, and can try to tailor that to fit them best. We focus on taking care of a lot of the chronic conditions that all of us deal with, whether it be high blood pressure or diabetes or even anxiety or depression. And one of the important parts of seeing a family physician is being able to identify issues before they become a bigger issue through preventative care. But when you feel like you've made that connection, you feel like you've improved their quality of life, that's what's rewarding about what we do. Having a family physician, I think, is important for both children and adults, because you don't know when the problem's going to occur. And I think if you have that personal relationship with your physician, they can tailor the care to better suit you whenever an issue does come up. I think it makes obvious sense that you're more apt to open up to someone you're comfortable with. That goes with all walks of life. And if you're comfortable with your primary doctor, you're going to be more willing to discuss difficult things, such as things that are stigmatized like anxiety or depression. And I think a lot of people don't even realize that that's a real issue that's affecting them. They think that that's something that's just part of life and that's something they've always had to deal with. And I've had conversations with people, and after discussing it, they realize, well, yeah, this is a problem. This is something that we could potentially work on together to get better and maybe have higher quality of life. And I think it's more common for men to delay coming in to get the care that they need. They're more apt to wait until the problem has become something where they just can't ignore it anymore. Where men, I think, tend to ignore problems, I think in this area, women have a tendency of taking on more, and they like to focus on taking care of everyone else, and they will sometimes forget to take care of themselves. So they focus on their children, they focus on their spouse, their parents, and sometimes their own personal health care becomes neglected in those situations. But it's just important. The line that I'll say is you can't take care of someone else until you take care of yourself first.